everyone, welcome back to my channel Microbiology Easy Notes. If you like this channel, please like, subscribe, comment and share. Today's topic, cholera. Cholera is an acute diarrheal disease caused by the bacterium Vibrio cholerae. The bacterium causes infection in small intestine. Cholera mainly transmitted when bacteria enter into person's mouth from food and water contaminated with Vibrio cholerae. Vibrio cholerae present in feces. When human takes fecal contaminated food or water, bacteria pass through the stomach and reach into small intestine. Their bacteria multiply and release cholera toxin, result in massive fluid loss. What are the sources of infection of cholera? The first is drinking water contaminated with feces, eating raw or undercooked seafood from contaminated water, eating raw fruits and vegetables, not washing hands after using toilet. Infected person shake unwashed hands with other healthy person. Cholera occurs by direct contact is a less common thing. Who are the people at risk of cholera? First is who consumes unsafe food or water. When people passes their excreta in or near water resources and drink that water without treating it. Person who eats unhygienic raw or undercooked food, seafood from contaminated water. People who are in the areas experiencing cholera outbreaks. When healthy person come in close contact with infected person, that increases chances of exposure. People who live in or visit areas with poor sanitation. Cholera is common in crowded refugee camps, slums, and areas hit by natural disasters, in conflict or in war, don't have safe drinking water. People who have limited access to health care. Delays in treatment increase severity of the disease and risk of death. People who have low stomach acid. The condition is called hypochlorhydria or aclohydria. Low acidity in the stomach makes it easier for Vibrio cholerae to survive and reach the intestine. People taking antacids, proton pump inhibitors, or with certain medical conditions fall into this group. Children and elderly are also at risk. Children are more vulnerable to dehydration and elderly people have weak immune system. Thus chances of infection are higher in them. Usually 12 hours to 5 days after infection symptoms occur. Where is cholera found? Throughout the history, there have been cholera outbreaks in almost every part of the world. Modern sewage and water treatment have certainly reduced the cholera cases in developed countries, but cholera still exists in parts of South Asia, Sub-Saharan Africa, the Caribbean, and Latin America. Symptoms of cholera. First is mild or no symptoms. Many infected people have no symptoms but can still spread the bacteria. If their stool contaminates water or food, or if they don't clean their hands after using toilets and then shake hands with others. Mild or moderate symptom. Watery diarrhea, which can be pale, cloudy, looks like a rice water and smell fishy. Cholera-related diarrhea comes on suddenly and can quickly cause fluid loss. Nausea and vomiting. Vomiting often happens in the early stages of cholera and it can last for hours. Stomach cramps. Severe symptoms. Profuse watery diarrhea. Severe dehydration. Dehydration can develop within hours after cholera symptoms start. It can range from mild to serious. A loss of 10% or more of a body weight suggests serious dehydration. It causes sunken eyes, wrinkled skin, and intense thirst. Muscle cramps. Due to severe dehydration, body experience rapid loss of salts such as sodium, chloride, and potassium that result muscle cramps. Shock. Rapid fluid loss causes drop in blood pressure and drop in the amount of oxygen in the body. It increases heartbeats and if untreated, it may cause death. Treatment of cholera. Immediate treatment is necessary because in few hours, severe symptoms may appear and cause death. First major and important step is focus on rehydration, and for that, oral rehydration solution, popularly known as ORS, is necessary for most of the patients. This can be made at home or packaged ORS solution is also available in the market. The right balance of sugar and salt help the patient body to absorb the water. After each loose stool, patient should drink 100 to 200 ml of ORS. Intravenous fluids. Severely dehydrated person who is unable to drink due to frequent motion and vomiting need intravenous fluid in a hospital settings. Antibiotics. Antibiotics like doxycycline and ciprofloxacin can be used for severely ill patients. Zinc supplements. Children between 6 months to 5 years require zinc supplements. It reduces the severity and duration of diarrhea. Supportive care and constant monitoring is essential for the patients. In case of children, breastfeeding is also important. How one can make ORS solution at home? For this, we require 1 liter clean, boiled and cooled drinking water, 6 teaspoons of sugar or 2 tablespoons of sugar, half teaspoon of table salt. Mix all these things together and solution is ready to drink. Cholera can be easily treated. Death from serious dehydration can be prevented with a simple and low-cost rehydration solution. Prevention. Millions of people either get infected or died because of cholera every year. The fact is, over 2 billion people don't have access to clean drinking water and basic sanitation facilities. So how we can prevent this disease? First is use only safe drinking water. If in doubt, boil the water, cool it down and then drink it. Use bottled water with unbroken seal. Use chlorine treatment products by strictly following label instructions. Use filter with a pore size of 0.3 micron, but still water needs boiling or chlorine treatment. Always cover food and water. Safe storage is important. Consume hot, properly cooked food. Do not intake ice made from unhygienic water. Good sanitation practices. Rigorous hand washing is important. Always wash hand before, during and after preparing food, before and after eating food or feeding children, after using the toilet or cleaning a child's bottom or changing a diaper, after caring for someone who is sick with vomiting or diarrhea, after treating a cut or wound or after blowing one's nose, coughing or sneezing. What is the effective hand washing procedure? Wet hands, lather it with soap, scrub hands thoroughly for at least 20 seconds, rinse well and then dry it. If soap and safe water are not readily available, 70% alcohol can be used as an alternative. For healthcare providers, in settings where other options are limited, 0.05% chlorine solution may be used for hand disinfection. Implement safe sanitation and waste management. Always wash hands with soap and safe water after using the bathroom. In the absence of toilet, defecate at least 50 meters away from any body of water, including wells. When digging new or temporary pit toilets, ensure they are at least 0.5 meter deep and situated at least 50 meters away from any water source. Maintain environmental cleanliness. Food preparation areas and kitchenware should be cleaned thoroughly with soap and treated water, then allowed to dry completely before reuse. Toilets and surfaces that have been contaminated with feces must be cleaned and disinfected. Oral cholera vaccine should be taken few days before traveling to an area where cholera is present.